and hi!
We, Group 4 from 1F, representing on
How the Ministry of Health managed the issues about obesity in Malaysia.
Our members are Nurania Sofia, Nur Elisha Shakila, Aimi Zulaika, Aida Batrisha, and Nur Adriana Maisara.
Our objectives for this presentation is using the SWOT, which is Strength, Weakness, Opportunity, and Threat analysis on how the Ministry of Health Malaysia managed the issues about obesity in Malaysia. The second part, which is our suggestions or recommendation to manage the issues.
Now we are talking about the strength in managing obesity in Malaysia. So the first one is public education and awareness campaign. For example, KKMs runs ongoing public health campaigns such as My Best Me, Bulan Pemakanan, and also the other awareness campaign. This can help to educate the public about eating healthy food and having a good or a better lifestyle. Next is promotion of healthy food. For example, do initiative like the Healthier Choice logo and collaboration with food outlets that encourage healthier menu, because this can help consumer choose lower calories and nutrient or better food. And next is community and school-based programs. For example, KKM implements a program that targeting children and families to promoting healthy lifestyle through their participation in school or any community programs that can lead them to know more about eating a healthy food and better lifestyle for their future.
Hi everyone, today I would like to talk about the weaknesses based on how the Ministry of Health managed the issue of obesity. So the first one is weak policy and force. As you all know, in Malaysia, in school, workplace, food premises, booths are not strictly enforced. There's more unhealthy food are widely exposed and available out there that we can get with a cheaper price compared to healthy foods such as salads. On the other hand, unhealthy food has more attraction due to preservative flavor and low preparation costs. As a result, the unhealthy food become more attractive to human. The second one is not enough collaboration. The Ministry of Health often works alone to against obesity in Malaysia. For example, school may not fully support healthy eating or physical activity without strong cooperation with the education sector. On the other hand, poor public transport and also lack of safe walking or cycling path reduce the opportunity for physical activity. When other department of ministry do not work together, this will make obesity control less effective. That's all for me. Thank you.
Next, for my part, I will be presenting the opportunities in managing obesity in Malaysia under the SWOT analysis. In the SWOT analysis, opportunities refer to external factors that can support and strengthen the Ministry of Health efforts in managing obesity in Malaysia. First, strong government support allows the Ministry of Health to continue and expand programs that promote healthy lifestyles. Next, growing public awareness about health helps make campaigns on healthy eating and physical activity more effective. Another opportunity is collaboration with other sectors. Working with school, communities, and private organizations helps the Ministry of Health reach more people. In addition, the use of digital technology enables health information to be shared more easily through platforms such as mobile application and social media. Last but not least, supportive national health policies provide clear direction for long-term obesity prevention and management. Therefore, These opportunities support the Ministry of Health in managing obesity in Malaysia more effectively.
Furthermore, I will be talking about our next SWOT analysis, which is T for threat. There are several threats and challenges in managing obesity issues that the Ministry of Health Malaysia faces, which many Malaysians may or may not realize because they are often overlooked. One of the major challenges is dietary habits, especially among younger generation and students. Fast food and processed snacks become their main food source. As a result, the obesity cases among younger generation are rising rapidly. As of today, the youth consumes more than 50% of processed foods that are high in fat and sodium, more than compared to a decade ago. Secondly, our next challenge is financial costs. Many insurance companies do not cover obesity management, and obese individuals often face higher insurance premium. So, as a result, obese individuals cannot afford, or their insurance premiums become too costly for them to pay. And lastly, the lack of policy integration. While our Ministry of Health takes obesity issue very seriously, it doesn't necessarily mean that the rest of our ministry do. For example, the Ministry of Trade and Industry very rarely take public health outcomes such as obesity as a concern. Importing or exporting food, they don't really take it into consideration.
Assalamualaikum, my name is Nurania Sofia Betikade. Right now I want to present about my part, which is the suggestions. Firstly, we have the stringent policy enforcement. Implement stricter regulation on sugar content, food labeling and advertising of unhealthy food, especially for children. Secondly, we have the enhanced community-based program. Expand community fitness program and local health screening, especially in rural areas. For example, conduct regular health education campaign on balanced nutrition, portion control, and healthy lifestyle. Third, we have the promote healthy food accessibility, subsidies healthy food option, and encourage healthier menus in school and workplace cafeteria. It provides government subsidies or vouchers for healthy food such as fruit, vegetables, whole grains, and lean proteins. Fourth, we have the integrate digital health solution. Develop MOH endorsed mobile apps for diet tracking, physical activity monitoring, and health education. For example, we need to wear the technologies, utilize smartwatch and fitness trackers to monitor daily step, heart rate, and energy expenditure. Next, we have the strengthened inter-ministerial collaboration. Work with the Ministry of Education, local government, and youth and sports to promote healthy lifestyle across all age groups, to ensure coordinated planning, implementation, and monitoring of obesity-related policies. Lastly, we have the continuous public education. We need to use social media influencers to promote sustainable healthy habits, to share consistent evidence-based health message through websites, social media, mobile apps, and online campaigns. I think that's all from me. Thank you.